contaminated and dirty abdominal procedures, and prophylactic negative pressure wound therapy in closed surgical incision and in high-risk wounds. You can also use triclosan coated sutures, which are antibiotic coated sutures. They may be somehow beneficial, and minimize biological spill. Body fluid spill should be avoided to minimize risk of SSI. Post-operative measures to prevent SSI. Again, we have to maintain the vitals, maintain FiO2 up to 4 to 6 hours post-operatively to 80%. Blood sugar monitoring, target blood glucose level of less than 200 milligrams per deciliter, maintaining normovolemia, normothermia, and providing adequate nutritional support. Surgical antibiotic prolongation is now not recommended even in presence of drain. Daily wound care is very important. Manage wound appropriately, including cleansing, dressing using sterile dressing material, and care, that is removal of discharge if present at site, according to the given wound situation. Remove wound drain whenever it is clinically indicated. Daily, you have to evaluate the wound for any abnormal discharge, redness, swelling, and pain at surgical site, and immediately take corrective actions. OT disinfection is performed with a high-level disinfectant in between the cases and the last case, that is terminal disinfection, and of course, periodic surveillance and monitoring of air quality of operation theatre at least weekly is also recommended. So these were the pre-operative measures. You can use care bundle. Care bundle is a grouping of best practices that individually improve care, but when applied together, result in substantially greater improvement. Science behind the bundle element is well established, that is the standard of care. Bundle element compliance can be measured as yes or no for audit. That is, you can prepare a checklist and whatever I have told you preventive measures, you can include them and write yes or no. In this way, you can perform surveillance for SSI. And of course, CSSD, as you know, it is the heart of hospital. Hospital administrators should appreciate the full and ultimate significance of a CSSD, which prima facie seems costly. But if you see, if your CSSD is intact as per standards, SSI is going to drastically reduce. So, to summarize, SSI is a major problem in surgical patient. Significant mortality and morbidity and expenses account for SSI. Prophylactic, antibiotic, grading of wound, and timely surgery are important factors decreasing the risk of SSI. WHO's surgical safety checklist proven all over the world, and it is highly recommended to bring down the SSI. There is always importance of SSI surveillance and using SSI checklist or care bundle in hospital. Lastly, safe surgery saves life. Thank you very much for your kind attention.
Thank you, Dr. Vikas. Now the floor is open for any questions or any